Good morning. Is it morning actually?
Oh no, it's not
afternoon. I was just going to say, well done. I was thinking we were really on time. I was thinking, no, we are on time, but it's 12:30. So we're just getting everybody into the webinar. Lovely to see you. Hopefully you're expecting to be at our webinar entitled Learning from the Pandemic, Compassionate Leadership for Compassionate Care. So we're just letting everybody in from the waiting room. If you do want to tell us who you are in the chat, you're most welcome to. It's nice to see you all. And in a minute, I shall hand over to our prof. Just gathering our participants. We had quite a lot of interest, so Helen will tell me when the waiting room is slowing down.
It's starting to slow, but could everyone who isn't on mute please just press mute so that we don't get disturbed through the presentation?
Oh, yes. Sorry, I'm supposed to do housekeeping. Helen is entirely right. If you could go on mute while Michael's presenting, that would be super. And we'll have about half an hour to 35 minutes of Michael's presentation. If things occur to you while you're listening and you want to ask questions and you don't want to forget them, do pop them in the chat. Helen and I will keep an eye on them. And then obviously once we've heard from Michael, we can take questions from those in the chat, or obviously you can use the raising of your hand function in Zoom. Okay, so I think I'm going to hand over to Michael. We're delighted that we've got time from Professor Michael West. As you'll have seen from all the blurb, he's a bit of a legend. So he comes to us as a senior visiting fellow from the King's Fund, Professor of Organisational Psychology, Lancaster University, Emeritus Professor Aston. He's got loads of titles and gongs and all of that. But we know that he is absolutely inspirational because we heard from him at the managers conference we ran earlier in the year, and we thought it would be brilliant for a wider group of people to be able to have the chance to hear from Michael on an online platform. So we're delighted to have him back. And yes, please go on mute. Helen, as the host, has the power of mute. So to avoid any further feedback, she may use that power. So Professor Michael West, I'm going to hand over to you. Thank you very much.
Thank you, Liz and Helen, very much for the warm introduction, and thank you for the privilege of being able to participate in the webinar, and a warm Monday greeting to all of you. It's a real privilege and a pleasure to be with you. And I want to really use the privilege of the time I have with you this morning by first painting what I hope is an honest picture of the situation we find ourselves in at the moment, before talking about some of the strategies that I think are really fundamental to how we transform for the future. So I think the situation that we face across health and social care, it's the most serious crisis that we've faced since the creation of the welfare state back in 1948. At the heart of that crisis is a workforce crisis, as the report of the Health and Social Care Committee, which was published today, reveals. We have huge numbers of vacancies across health and social care. The figure that's reported in the national press and by various agencies varies somewhat, but in social care, the figure is somewhere in the region of 140,000 vacancies. In the NHS, it's somewhere in the region of 90 to 100,000 vacancies. And of course, there are multiplier effects of those vacancies across the health and social care sectors. What we're also seeing, and what we've seen for some years, is steadily increases in levels of stress among staff working in health and social care. Skills for Care has been charting to some extent the rise in levels of stress among staff, which are a consequence of very high levels of demand and, of course, staff shortages. In the NHS last year, in the National Staff Survey, and I wish there was a National Staff Survey in social care as well, what we saw in the National Staff Survey with the introduction of a standardised measure of staff burnout was that something in the region of 1 in 3 staff in the NHS are burned out at work often or all of the time. And we know that has serious consequences for staff health, and we know it has serious consequences in terms of safe and compassionate care for people who use NHS services. Of course, the levels of stress have risen quite significantly during the course of the pandemic. Back in 2019, around 40% of staff in health and social care reported that they'd been unwell as a result of work stress in the previous year. That had leapt to nearly 1 in 2 by 2021. And so the pandemic, with its increases in demands upon staff, has of course had real consequences. And the wider influence of the pandemic on mental health and well-being and physical health across the country has had its own associated stresses, which impact on those working in health and social care. Of course, what this also means is that many staff under pressure choose to quit. They don't stay. And the level of turnover in social care is currently over 30%. So over 30% of staff leaving their jobs every year. And it creates enormous problems in terms of staffing, in terms of training people. The same is true in the NHS, with 1 in 4 nurses leaving the NHS within 3 years of joining. I mean, it's an astonishing level of quitting, of wastage, if you like, of skills. And the same is true in primary care, with GPs reporting the highest levels of stress that we've seen since the introduction of the GP Working Life Survey in 1998. So across the health and social care spectrum, what we're seeing is very similar patterns of vacancies, stress, intention to quit. And of course, there are increasing demands on the services we provide, which you'll be all too familiar with. It also tells us that the way that we are currently doing things is not working. We have no plan for social care in the country of any sophistication. We have no national workforce plan either for healthcare or social care in England. The same is not true in some of the other UK countries. And that we need to think about how we're going to work for the future to deliver high quality care for the people in our communities, so people at every stage in their lives can live fulfilling, happy, healthy, love-filled, safe, secure lives, so that they experience a sense of, joy and wonder, and at whatever stage in life they are. That's the gloomy situation we face. And what it, I think, tells us is, contrary to much of the current narrative about emerging from the pandemic, this is not just about how we emerge from the pandemic. It's about how we have to think about how we transform our care services for the future. And that's what I'd like to focus on today. What are the key ways that we can transform services? So in thinking over the last 2.5 years, I think the most important lesson that we have really been taught by all of this is the lesson of compassion. And it's the compassion, the extraordinary compassion that you and your colleagues have shown for service users. I mean, you will be well aware of the extraordinary acts of compassion, both individually and collectively, and particularly during the early stages of the pandemic, when we didn't know what this virus was about, when we were afraid for our own lives and the lives of our loved ones and the lives of our colleagues. And sadly, you know, many people working in social care lost their lives and lost loved ones, and also experienced the grief and the bereavement of losing those that you provided care for. And, you know, there's also the compassion that you showed for each other. We know from many studies over the last 2.5 years that what enables staff to cope, the key factor was the care of their colleagues, the teams that you worked in, and also the compassion of the community, that the vast majority of people stayed at home, protected our health and social care services, and didn't go and hug their loved ones. And millions of people volunteered formally and informally to help during the worst of the pandemic, and still continue to do so. So compassion, I think, is the most important lesson, and it has really powerful practical implications for the future. So what does it mean? Well, it's defined as a sensitivity to suffering in others and indeed in oneself, with a commitment to try to alleviate or prevent that suffering. In practical terms, if I'm to be compassionate towards one of you who's in pain or distress, then I have to do 4 things: attend, understand, empathize, and help. And attend means being present with you, listening carefully to you. Nancy Klein talks about listening with fascination. That provides a basis for understanding the causes of your fear or distress, ideally through having a dialogue with you. And that in turn provides a basis for an empathic response, feeling your pain or distress without my being overwhelmed by it, without making it my drama. And that in turn gives the motivation for the 4th critical element of compassion, which is helping you or serving you in some way. And we know from neuroscience studies over the last 20 years, there's a really critical difference between empathy alone and compassion with that additional helping component. Asking people to be empathic to another in pain or distress is associated with the activation of their own pain centers in the brain, because they're mirroring the other person's pain. But when we ask people to be compassionate, to have the intent to help, that's associated with the activation of reward centers in the brain. Why? Well, because hundreds of thousands of years of evolution have shaped us to have a core emotional regulation system of nurturing or compassion, because that's what enables us to connect with one another, to feel a sense of trust. Compassion's about blurring the boundaries between self and other. And compassion enables a feeling of belonging. And belonging is hugely important in human behavior. We're as likely to die from the effects of social isolation or loneliness as we are from the effects of, say, smoking. But we also know that compassion is hugely important in health outcomes across both health and social care. Over the last 20 years, there have been hundreds of studies, randomized controlled trials, a sort of gold standard of medical research, into the impact of compassion. And I want to show you just a few quick examples of these studies so that you can see just how important compassion is in health and social care. The first is a study of anaesthetists visiting patients prior to surgery, where they either do a visit and provide sedatives, or they do a visit without sedatives but are extra compassionate. And that compassion visit is associated with patients having a much lower requirement for painkillers post-surgically, and also a significantly shorter length of stay. The second example is a study of patients with an early diagnosis of lung cancer, randomly assigned either to normal early cancer care or to normal early cancer care plus early palliative care, if you like, extra compassionate care. And it's a study of quality of life, which found that the quality of life of the palliative care patients was much better. But what was a complete surprise was the finding that they also lived significantly longer. And we see similar large effects of clinician compassion in the treatment of long-term disorders like diabetes, HIV, and of therapist compassion in the treatment of mental health problems. Contrary to what most people believe, more compassion doesn't affect encounter length. It's a way of being rather than adding in more, if you like. But we also know that it has a significant effect on the person being compassionate. So randomized controlled trials with GPs and nurses show that when they're asked to be extra compassionate in their interactions with patients and service users over a 2-week period, that significantly affects positively their own mental health, lower levels of anxiety and stress and depression. So what the research tells us is that compassion is the most important intervention there is in health and social care, and the effect sizes are truly enormous. So in thinking about how we transform for the future, the challenge for us is, how do we create the conditions within our social care contexts where staff will be compassionate towards those they provide services for, where they'll be compassionate towards each other, because those things go intrinsically together, and also where they'll be self-compassionate, given what I said about levels of stress. How do we create those conditions? Well, the answer to that question is, it's about the culture of our organizations. How do we shape the culture? Well, every interaction every one of us has every day in our teams, in our organizations, is an opportunity to shape the culture. How warm, kind, irritable, cynical, compassionate we are, the ripples radiate out and affect others' behavior. They get replicated. If we lack civility, that gets radiated out. If we're altruistic and kind, that gets radiated out. But the role of leaders, we know, is particularly powerful, because we know from the last 100 years of research on leadership in organizations internationally, that what leaders pay attention to and what they focus on, and particularly what they portray in their own behavior, tells us what it is that they value, what it is that's important to them. The values of the organization, that's what culture is. It's what's important to us here. It's what we value. So if we want to create compassionate cultures, then leaders must embody compassion in their leadership. And in practice, practically what that means is leaders being present with those they lead, listening to them with fascination, seeking to understand the challenges they face, not just by imposing our understanding from some elevated hierarchical position, but through having a dialogue, a conversation. And leaders having the emotional intelligence to empathize with those they lead, to know what it's like, when you've been on your 3rd night shift in a row, you're exhausted, afraid to drive home because you don't feel safe, and then to help those we lead. And in the context of leadership, what that means is helping those we lead to do their jobs more effectively by helping to remove the obstacles that get in the way, and by helping to ensure they've got the resources they need, the right numbers of staff, the right equipment if relevant, and the right training. And this is not some new model of leadership. We've known for 60 or 70 years from Leadership Research internationally that these 4 behaviors are critical to effective leadership. The most important skill of a leader is listening to those that we lead. And the most important task of a leader is helping those we lead to do their jobs more effectively. And we also know that in organizations across sectors, in the private sector, in health, in social care, we know that these behaviors are critical to the outcomes we seek. So to give you one example, I had the privilege of leading the design of the first national staff survey in the NHS back in 2003, and that survey has run every year for 18 years, with over 630,000 people now responding every year. So it gives us the most enormous data set, and we can do the most sophisticated statistical longitudinal analysis. And what it tells us is, when staff in NHS organizations generally report their leaders behave in these 4 ways, subsequently what we see in those organizations is higher levels of staff satisfaction and engagement, patients much more satisfied with the care they receive, better care quality as rated by CQC, and better financial performance. Where staff generally report their leaders don't behave in these 4 ways in NHS trusts, subsequently what we see in those trusts is staff reporting higher levels of chronic work overload, higher levels of stress, patients report being treated with less dignity, respect, compassion, there's worse care quality, and in the acute sector, significantly higher levels of avoidable patient mortality. So for all of these reasons, I think compassionate leadership is really key to how we transform our organizations in social care for the future. But this is not some soft cushions, scented candles approach to leadership. Absolutely not. On the contrary, it requires much more, I think, courage and authenticity than the rather easy opt-out of command and control leadership or directive leadership, because our compassion is ultimately for the service users, the residents that we serve, and for the staff that we lead. So it's about being effective as a leader. It's about being inclusive, collective, and working across boundaries. And I just want to explain a little bit about each of these, just to really flesh out what we mean by compassionate leadership. Because if leadership's not effective, then it's not compassionate, because we are in the people business. So effective leadership creates direction, alignment, and commitment. And direction means, and this is, I've been studying teamwork and organizations in health and social care since the mid-1980s. And the key factor that predicts, for example, the performance of teams in health and social care is whether they have clear direction. That is, a clear understanding of the purpose of their work, which is translated into 4 or 5 clear, agreed, challenging goals. And so this purpose or vision, if you like, is not just some bunch of words on the website. It's a beacon that guides our decision-making and the way we behave day by day, hour by hour, and that leaders constantly refer to. And it's translated into 4 or 5 clear goals in every team, from the leadership team of the organization through to every team within the organization, that they have 4 or 5 clear goals aligned around that vision. What we see in many organizations is so many targets and goals and priorities that it's not clear what the direction is, because people are just overwhelmed. And alignment is making sure that people's efforts are then aligned around that direction and purpose and those goals, not being dissipated on lots of unnecessary bureaucracy or petty interpersonal conflicts or interdepartmental or inter-team conflicts. And commitment is about trust and motivation. And if leadership's not inclusive, then by definition, it's not compassionate, because compassion, as I said, is about belonging, and inclusion is about belonging, and exclusion or discrimination are about rejection. And we know that, if a little girl is excluded from her friendship group in the playground, it has an impact on inflammation of the central nervous system with health consequences. Those subjected to discrimination throughout the lifespan, people with disabilities, people from minority ethnic groups, experience biological weathering effect with negative health outcomes. So compassionate leadership is about everybody feeling included, attended to, understood, empathized with, and helped. And that's critical for the future to, so that we utilize all of the resources within our teams and organizations. And I know from the research we've done over 35, maybe 40 years, that more diverse teams, when they have positive climates, are much more innovative, productive, and effective than teams made up of similar people. So we have to value diversity for the future and make that, the way that we work together, valuing diversity, whether it's multi-professional diversity or diversity in terms of demographic background. And compassionate leadership is not about me being nice so I become more powerful. It's about helping everybody to feel they have leadership responsibility. After all, quality of care and compassion are everybody's responsibility in social care. So we need to encourage everybody to feel they have leadership responsibility. I mean, I always think that, we have some of the most skilled and motivated people in the whole of the workforce in social care. So why manage them through command and control and hierarchy? Even in the military, there's the concept of mission command, which is now widely implemented, where the senior leaders make decisions about strategy, but people are trusted at local level to implement that appropriate to the work that they're doing. And it's about also compassionately working across boundaries with other teams, departments, in some cases, organizations, the voluntary sector, the healthcare sector, attending, understanding, empathizing, and always asking the question, how can we help you? So that together we deliver more effectively for the communities we serve. And I think that the only way forward for us is to develop more team working in social care, more effective team working, and to work more effectively across boundaries, working with other sectors, with local authorities, with community groups, with healthcare, with the voluntary association, with families themselves, so that we integrate all of the resources that we have available to help people live their lives as happily and as well as they can. And that's already being it was kind of really well demonstrated during the pandemic, as we saw more collaboration between primary care and social care across boundaries, but also in places like Wigan and West Yorkshire and Harrogate, and indeed many others, Bromley by Bow in central London, where there's an integration of services and working with the community to co-design, co-create social care services and healthcare services. So it's about how we create more compassionate and inclusive cultures for the future. And there's a link there to just a huge array of tools that I've been involved in developing with the King's Fund and the Centre for Creative Leadership over the last 7 years to support organisations and leaders to help develop more creative, more compassionate and inclusive cultures. So I think compassionate leadership is core to the future. What's also this huge issue is the issue of the levels of stress we're seeing in social care services. And I've been involved in 2 national inquiries over the last 5 years, looking at both, particularly in healthcare, but also in social care, at the mental health and well-being of staff. And what we see is that the typical response to high levels of stress is to introduce what we've called secondary and tertiary interventions, things like employee assistance programs, mindfulness apps, advice on exercise and diet and so on. But they generally don't address the underlying causes of staff stress. So I'm not dismissing those secondary and tertiary interventions, but I think the levels of stress that we're seeing are beyond mindfulness and yoga. So it's good to have those, but on their own, they're not enough. We have to address the underlying causes. And the way of understanding that is that what we're currently failing to do is to meet the core needs of our staff at work, which is why levels of stress are so high. And there are 3 core needs that we and many others have identified. We call them the ABC of core needs. People have a need to feel in control of their lives, their work lives more specifically. They need to feel valued and respected and cared for in their teams and organizations. And they need to feel that their work makes a positive difference, that they're effective in what they do. And so the first is the need to feel like we have voice and influence. We're not just cogs, we're not just being directed what to do, but we can influence the way we do our work, the decisions about our work. We also want to feel that we work in climates of justice and fairness and transparency, rather than climates of fear and blame, which in some organizations is dominant. I remember working particularly with Merseycare, a large mental health and learning disability NHS trust, actually quite an enlightened organization, but they went through big listening exercise with their staff. And what they heard was that staff were afraid a lot of the time. They were working in really demanding conditions, afraid they'd make a mistake, and that they saw a culture of blame in the organization. So they introduced a restorative just culture. Rather than focused on whose fault is this and punishment, more focused on who've been hurt by this mistake, all of the people who may have been hurt, what are their needs and who's responsible for meeting those needs. And they've eliminated 85% of disciplinaries and 95% of suspensions in their organization, with huge cost savings, of course. And it's about people having control over working conditions, having decent spaces to take rest breaks, actually being able to take rest breaks, being able to access hydration and so on at appropriate times, and having influence over work schedules and rotas so that we can balance the needs of our work and home lives. And many organizations are now introducing self-rostering or e-rostering, and actually with very positive effects on shift filling and also staff well. And belonging, that need to belong, is most met by the teams that we work in. It's the teams that we work in that have most effect on our work lives. So we need to ensure that these are teams that are characterized by positive climates, where there are clear goals. So we know that the most effective teams are those that have clear goals, 4 or 5 clear goals, and that meet regularly, have time to meet and review. What are we trying to achieve? How are we going about it? What do we need to change to make sure that we're continually learning? And people who work in such teams have 50% lower stress levels. So it's a huge impact. And we know that the more people who work in teams in an organization that have clear goals and that meet regularly, the better is the care quality, the better the financial performance, the better the service user satisfaction, and in healthcare, the much lower levels of avoidable patient deaths. So, but we also know that in many organizations, the quality of team working is not great. And that probably only around 40% of staff work in teams that have clear goals and that have time and space to meet regularly. So there's a huge amount of work we can do to build team working more effectively. And I'll come back to that in a moment. And the third, and I guess part of belonging is, of course, creating more compassionate cultures through compassionate leadership. And there are many organizations across the country that are now developing compassionate leadership cultures through compassionate leadership training. Health Education and Improvement Wales is committed now to providing a huge amount of resources on its website, there already exist, for creating compassionate leadership across the whole of health and social care in Wales. And the third need we all have that must be met is the need to feel that our contribution is effective through our work. And the key factor that inhibits that, we have found, is chronic excessive workload, chronic work overload. It is the number one factor in staff stress and the number one reason why people quit. So we have to talk about workload. And I think leaders are often reluctant to talk about workload because they don't have solutions. But it's not the role of leaders necessarily to have solutions to problems, but it is their role to ensure we're talking about the most difficult challenges we face. And I mentioned at the beginning, we have the biggest crisis we've ever faced in health and social care. And at the heart of that is workforce. And at the heart of that is chronic work overload. And of course, it's to do with inadequate staffing numbers and the fact that in England, there is no national plan for health and social care workforce, no projections for the next 5, 10, 15, 20 years, and how we're going to get those staff. That's a travesty. It's really good that in places like Wales and Scotland, they have those workforce projections and plans in place and are planning towards that. But it means at local level, certainly in England, there is a need to make sure that we're continually addressing the issue of staffing. But it's also about what we're not going to do. We can't just keep demanding more and more of staff, because the problem is that we lose them. And then we have to retrain people, we have to attract people, then retrain them. So addressing the issue of workload is asking what we're not going to do. It is, I think, one of the fascinating things we've discovered about human behavior is when you ask people to improve a system, whether it's, I don't know, an appraisal system or a Lego building, 95% of people add something on. We just keep adding stuff on, and it just, increases the workload. One of the large organisations I've worked with over the years, East London Foundation Trust, Mental Health Learning Disability Trust, regularly asks its staff, what would you reduce in your work or get rid of, in consultation with service users? And they've eliminated 85% of clinical audit activities, bureaucracy, in the context of a strong quality improvement culture. It's about improving team working, because that we know has an impact on workload. It's about using new technologies, of course, and it's about how we work with families, communities, voluntary organizations across boundaries as well. So the point I want to make is that the problems of stress among staff, we're going to be most effective in addressing those problems when we ensure that we're focused on better meeting the core work needs of staff. So that's a critical requirement. I've talked a lot about team working, and it's really about, that we can kind of talk about team working in a sort of apple pie way. Oh, we're all one big team here, but it's making sure that our teams are actually working effectively. I'm not going to go through all of this. You'll have the slides after the presentation, but there are some clear questions that we can ask about, are our teams working effectively within the organization? And getting these things right makes a profound difference to quality of care, to team member well-being, to reducing error rates, to service user satisfaction, and so on. So it's getting these things right and making sure, particularly, that there are no chronic interpersonal conflicts in teams. Incivility, aggression, discrimination, interpersonal conflicts are a disaster for team working. So we have to cultivate a climate within which the inevitable disagreements that may occur from time to time about what we're doing and how we should do it don't spill over into interpersonal conflicts. It's about everyone taking responsibility for compassionate team working, noticing each other's suffering at work. How are you? No, really, how are you? I know you've had a tough week. Can I help you? Recognizing that errors, missed deadlines, poor performance often are masking things like poor, inadequate staff numbers, chronic work overload. And it's recognizing that compassion is also about having the courage to address when there are corrosive politics, conflicts between teams, chronic toxic interactions between particular individuals, and raising these issues and talking about them. Is also making sure that our teams have time to stop, take time out, reflect and learn. We know from all of the research we've done that teams that take time out on a regular basis to stop, to review, to reflect, to have debriefs after action reviews are between 35 and 40% more productive. Whether you're looking at the leadership team of an organization or frontline teams in organizations, the same is true. Teams that take time out regularly to review, reflect and learn are between 35 and 40% more productive and much more innovative, developing new and improved ways of doing things. So to summarize, these are the key factors that I've mentioned. I'm not going to go through all of these. They're the key themes. It's a sort of aid memoir for you. During the course of the last 2.5 years, I've been able to pull together lots of resources, research evidence, practical tools, links, videos, and so on, in the form of a book called Compassionate Leadership, Developing Wisdom, Humanity and Presence in Health and Social Care. The final chapter focuses on self-compassion, because I think that's the most important message in all of this. And I want to finish with that with you and mention it at 3 levels. Self-compassion, and by the way, I know that people working in social care often kind of recoil from the idea of self-compassion. We're here to help other people. We're not here to, mollycoddle ourselves. Well, actually, all of the research evidence tells us that our ability to be self-compassionate translates into our ability to be compassionate towards others. All of the research on recovery from stressful work tells us we must engage in activities that enable psychological detachment, like, I don't know, watching a Netflix series, having a nice dinner with the family or friends, reading a novel, relaxation, meditation, engaging in activities outside work that are a bit challenging, cooking a really nice meal, having proper work breaks is important for safe care for those we look after, as well as for our own recovery. And spending time in nature is hugely powerful for recovery, particularly blue environments, then green environments. And we know that those whose work is most stressful are least likely to do these things. It's also about putting into practice in our lives the 6 ways to belonging, to well-being, and the most important by far is the first one, spending good quality time with the people we love and who love us, is by far the most important in our well-being. And I'm going to mention also getting enough sleep. The purpose of sleep is repair and maintenance, and we need 7 to 8 hours of sleep. The typical adult takes 6 to 7 hours of sleep, so they're losing one night's sleep a week in repair and maintenance, with damaging physiological and psychological consequences. So the deepest level of self-compassion is having the courage to be self-aware in the moment, to pick up on when I'm feeling tired or irritable or hurt or ashamed or inadequate or even joyful, whatever, and accepting those feelings rather than denying them or repressing them or feeling guilty for having them, and then inquiring into them. Why am I feeling like this? Oh, I just had that difficult interaction with a colleague. And then bringing a caring attitude towards ourselves, nurturing ourselves, which we know is fundamental to our ability to nurture others. After all, each of us is as deserving of love as every other human being on the planet. And when we connect deeply and authentically and courageously with ourselves in this way, it enables us to connect more deeply and courageously and authentically with all of those we provide care for, all of those we lead, all of those we work with, indeed all of those we interact with in our lives. So this begins with having the courage of self-compassion. So thank you very much. And I'm sure, Liz, the slides will be circulated to everybody after today. And I hope I've left sufficient time for questions. Thank you.
Super. Thank you, Michael. As inspiring as ever, I think. So yes, we will share the slides and the recording of the session with the people who have signed up. And I'm always struck by some of the phrases that you use, the listening with fascination, thinking about that kind of multiplier effect of staff pressures, and the idea of biological weathering. There's all these things, you know, the link between the emotional and mental state and the physical health, I think, is the thing that's always really stands out from the way you talk about your work and your insights. So I guess we have got a few comments in the chat, and I guess thinking, and I'll give it a minute to see if anybody wants to raise their hand and ask any questions. I guess some of this feels like it's not within our gift, in the sense that that point about leaders being able to equip their teams with, you know, the right resources, the right levels of staffing. You know, some of those things are quite hard at the moment. And I guess trying to balance that then with the things that are within our gift, I guess, so it is potentially what we have before us. So thinking about the fact that, you know, as you say, the Skills for Care data last week showed us with 165,000 vacancies, I think, across the sector. And we've obviously heard from the Health and Social Care Select Committee today, again, about this kind of the lack of the national grasping of this nettle. It seems extraordinary, but anyway, we'll keep at it. I guess thinking about those other things then, if we can't, it looks like we're up against it with our workforce vacancy numbers. So thinking about things differently. Out of the things you've covered, what would you say would be the kind of 2 or 3 absolutely key things we can do now in the next kind of 6 to 12 months as leaders? Because I think on this call there are a lot of leaders.
Yeah, so I think it's really important. You know, if you want me to pick out what I think is really important, the first and most important thing as leaders is that we practice self-compassion. Because our ability to lead, to listen, to understand, to empathize, to help is going to be dependent on the extent to which we're nurturing ourselves as well. If we drive ourselves into the ground, then there will be physical and psychological consequences of that. And I think it's quite a leap for many people working in health and social care, the idea that I should be focused on nurturing myself in the sense of being present with myself and having the courage to be with what I'm feeling and, you know, bring a nurturing attitude to myself so that that clears away a lot of the flotsam and jetsam that can get in the way of our connecting with others. So that's the first. And I think the second is that we may not have solutions. And I do think that a lot of leaders don't, you know, have difficulty talking about the problem of work overload and lack of staffing because they don't have solutions. But I think what that does is it maybe communicates to staff that we don't really understand the problems of work overload, or we don't understand the consequences of not having enough staff. So I think listening and having the courage to have those conversations about workload. And that may mean saying, look, I don't know what to do. This is where we are, but I do know we need to keep looking at this and talking about it, is the courageous thing to do as a leader. And it does mean letting go of that or taking off that mantle of leadership that says I have to have the solutions to everything. No, that's not what leadership is. Leadership's about, as I said, focusing on the most important things that we face. So self-compassion, talking about the key issues like workload and staffing. And the third, I think, is building team working, because as I said, people's day-to-day experience is primarily mediated by the teams they're a part of. And there is a lot of work to do, I think, to build more effective team working. And we know that when people work in teams that have clear goals, clear roles, where they meet regularly to review, to learn, to debrief, to have end of shift conversations, that they're much more effective in the delivery of care, but also stress levels, as I said, are 50% lower. And there's an impact also on the outcomes that we seek. And also there's an impact on service user satisfaction. There's impacts on productivity. So, you know, my estimate is that about 40% of staff in social care work in teams that have clear goals and that have time to meet regularly. But when they do that, they're much more productive and they're much more innovative, and they are more effective in coming up with new and improved ways of doing things, which is going to be critical for the future. So self-compassion, talking about the key issues we face with those we lead, and nurturing team working. And that slide that I didn't go through in detail with those questions, I think is a very practical guide to what we need to get right. And making sure that teams have got time and space to meet regularly. To have those conversations is critical, I think, to our ability to address issues for the future. So those are the three things that I think are most important. But I think there's a longer term issue, which is about how we develop conversations across boundaries with other sectors, with community groups, with voluntary sector groups, with all of the agencies involved in the well-being of people in our communities, how we start to have conversations about how collectively we can better take care of the people of our country so that they live their lives more fully, more rewardingly, more fulfillingly for the future. So three issues now, Liz, and one I think which has to be on our agenda for the future.
Thank you. Thank you. I can see a couple of hands up. Oh, I see a hand up, and then somebody's went up and down again. Lisa.
Thank you, Liz. I'm hoping my internet's going to hold out. It's been wavering a little bit. Thanks, Michael. That was fascinating.
Hi, Lisa.
Just in terms of the level of vacancies in the social care workforce being at around 165,000, do we know what sort of percentage that represents, please? That may not be a question for you. That might be better levied at perhaps Liz. Not sure.
It's about 1.6 million jobs in social care.
Okay.
So
1 in 10, 1 in
10%.
9.
10%,
Yeah,
10%. Yeah,
yeah.
lovely. Okay, thank you.
I mean, it is huge, Lisa. It is a huge vacancy rate. And so it does indicate that we can't just go on doing things the way we're currently doing them. So transforming for the future, I think, is fundamental.
Absolutely. Thank you.
Kathy.
Thank you, Michael. Absolutely fascinated by what you said this morning, and some of the things that you've reiterated on about being kind to oneself, living in the moment, etc., which I have to say try and do. And certainly when you read through Nancy Klein's Listening with Fascination, and all of the key points that she makes, seems quite easy to do in some ways, but much more difficult when you think of where social care sits along with other partners. So just some comments really. I mean, for me, it is about cultural changes, both locally, but certainly even more vast than that, going across the country as a whole. Because actually, if you change culturally, locally, you'll still be up against the larger organizations that perhaps haven't changed. And I just wonder, in actuality, where you see that culture change happening across England, bearing in mind what some of the other countries have done.
Yeah, no, absolutely, Kathy. I think it is, I hope I've communicated how harrowing the current situation is for you all working in social care. I'm aware of just how harrowing and hugely difficult it is. And there is this, sense in the wider context of society of a lot of anger, of a lot of schisms, a lot of blame, bouncing around in our society. I guess what I also experience, though, every day is the kindness of neighbours, the warmth of strangers on the street where I live here in Sheffield. And I see every day examples of the wonderful kindness and generosity and courage of people working in social care. And my view is that, we need to transform the national context. And I particularly think of the behaviour of politicians in this. I think it's both odious and really corrosive to our society. And then I think also that if you take health and social care together, we are talking about something like 1 in 8 people in the entire workforce of our country. So I think, in a way, of health and social care as being collectively the most powerful agency, in the most powerful institution in the whole of our society, by far and away. So if all of the people who work in health and social care, around 3.8 million, come into work every day and encounter compassionate teams and cultures, then they take that back out into their families and their communities. And if all of the people who are the recipients of social care, indeed of healthcare, every day encounter compassionate care, then, as I said earlier, that radiates out and they take that back out into their families and communities. So I have a vision of health and social care really creating, nurturing, compassionate cultures that and those will inevitably radiate out into the wider society. And I think there is an enormous thirst in our society at the moment for that. So I think that's a cause for hope. So instead of seeing, in a way, health and social care, particularly social care, as being at the mercy of the wider culture, I think health and social care together can create that wider culture. Thank you.
Thank you. There's some really interesting reflections in the chat, by the way. There's a few people wanting you to, enter that leadership contest, Michael. Fancy running the country. I realise we haven't got many minutes left, but I've got 2 more hands up. Brian.
Yeah, it was only brief in relation to my comment in the box, and I just think there's a radical rethink of what we perceive as costs in human resources, where there's a disproportionate emphasis on resource and cost compared to humanity, human resource. And I wonder whether we should even do such radical things as redefining compassionately, where we all know compassionate is a bit late. It's when the person's dead, and we all wrap up lots of other types of leave models. But actually, could we turn compassionate leave as the definition into a basic time away in terms of the element of self-compassion, and broaden it, which I guess was probably where its root came from. Because we focus on the cost and not the human investment, we tend to consider it as time out that's costing us, as opposed to time out that's investing in our team.
Yeah, that's future proofing. It's an interesting concept.
Yeah, really helpful idea. Thank you, Brian.
And Paula, you've got your hand up.
Yes, thank you, Michael. I just wanted to, I think, throw light on the issue about the bureaucracy when it comes to the amount of paperwork and documentation in health and social care. I think talking about the changing culture, recently care has moved on from hands-on care to more of an academic field. And I think that's one of the major contributions towards the vacancy we're having in social care. Because when you have, in a few years back, people want to come into care because they care, they want to do the job, they can do practical work. But now when you have people coming for interviews, one of the scary bits for them is the paperwork bits, the trainings, the academic side of it. So care is gradually moving away from what it should be, which is that proper hands-on care, showing the compassionate service. And that's also adding pressure onto staff. So if you have, for instance, team leaders who are basically doing more clinical and arithmetic work, they have to do quite a lot of documentation. So we can talk about being compassionate, we can talk about workload and how to manage teamwork. But until we start revisiting that issue about how do we reduce that bureaucracy of documentation, I know it's important to document and evidence your work, but it's becoming more of it, primarily more of that academic aspect of it, and that's scaring people from coming into care. And those who are on it, it's adding pressure to them. And then when you equate that to the pay, it doesn't follow, because you're having carers on basic minimum wages and they're doing more work, both physically, mentally, and otherwise, and yet they're being paid the least in the sectors of any working environment. So there's a contribution, a lot of factors that we need to look into to see how we can manage the work expectation, the basic salary that they receive, and the workload. All of this is hard to talk about compassionate care from carers. They want to be compassionate, but when they look at the pressure, it takes away that interest, that ambition to want to be compassionate in their work, or even to themselves, because it's so much task put on them, and the expectation from
exhausting.
Yeah.
It's exhausting. Yeah. I mean, the toxic cocktail is high demands and low control, and particularly when many of the demands that you're having to deal with feel irrelevant to the core purpose that you're there for. I always say, I always think dolphins don't pay taxes. What have we done to ourselves as a species, we human beings? We've created all of these tasks and bureaucracies, and we have to ask, what is it that's really adding value? I mean, I think the example of East London Foundation Trust regularly asking their staff, what would you get rid of? And the main thing they've got rid of is lots of unnecessary bureaucracy. But we also need those conversations at national level, so that Care Quality Commission is looking at the extent to which it is creating, and other national organisations, the extent to which they're creating demands on the system, which are adding unhelpfully to the pressures that we have. And there is the beginnings of a national debate about those issues. But I'm always struck, when you talk to staff about workload and they go home feeling that they haven't completed all of the work they needed to, what doesn't bother them so much is the unfinished bureaucracy. What really bothers them is they haven't been able to provide the quality of care that they want to provide because of all of the other tasks that they have to complete. And so I agree with you. And the observation I made about the fact that when we think we're improving a system, we're often just adding and adding and adding more stuff. And we seem like we don't have the self-awareness and insight to recognize that simplification is often the solution. I mean, if you take the example, Paula, of electric cars, what they have done is just got rid of the entire engine. About 3,000 things that can go wrong. It's amazing simplification, and I think that's what we need to begin to create an understanding of, the need to simplify, both at national and at local level, and within teams, because teams often have the solutions to many of these things. But I absolutely endorse what you say and agree with you.
I think we have some opportunities, I have to say. The Care Quality Commission is busy sorting out its regulatory model. We can keep pushing for streamlining and reducing all that stuff. And we have digital ambitions that might make some of this a bit easier. So I feel like there are some opportunities within our grasp to try and do something about that relentless admin burden. But let's try and keep it to the point, which is there to protect people, but it's not there to replace care. I'm conscious we're over time. I've just got one other question in the chat. Well, I've got big thanks to Penny Robinson, who's been putting loads of great things in the chat. Thank you. And Pauline is asking if we have any recommendations for courses that people in social care can access to practice deeper listening skills. So if there's anything in your suite of resources, Michael, that we can use to help us listen with fascination more.
Yeah, well, in the book, I've describe some of the kind of practical tools for listening. A lot, and a lot of the listening with fascination is about the practice of being present with others. We're often with others and we're so busy thinking about the meeting we just had or what we've got to do next that we're not actually present. So there's something about being present, not making that another task, but recognizing that just simply letting go of all of that other stuff, what's coming next, what's just happened, just letting go of all of that and relaxing in the moment to being present with the other is the basis, I think, for being compassionate and listening with fascination. Nancy Klein's wonderful books on listening are really powerful. And, I think it's something, I think that this is something that we need to practice, not as another, demand on us, but as a recognition that when we are present with others and we listen with fascination and we're empathic, it has beneficial effects for them. They feel a sense of connection and belonging, and it also has beneficial effects for ourselves, that we are enriched by that connection. Because, in a way, what we're coming to understand more and more is that the nature of our existence is about interconnection. It's not about separation. It's about belonging. It's about our interconnection with each other, our interconnection with the rest of biodiversity, our interconnection with the planet. and being present and listening and empathizing and helping is a way, I think, of nurturing a recognition of that interconnection. And I think that's key to our future, not only in health and social care, but as a species on this planet as well.
Thank you, Michael. So we're a little over time. I'm going to draw us to a close. I want to say a huge thank you to the Prof, to Michael. Thank you very much.
It's a pleasure and a privilege. Thank you.
And thank you to all of you who've given up your time to come and listen and engage and bring your examples and your thoughts and your reflections. Hugely helpful. Thank you. And as I say, we've got the slides and the recording, and we'll just sort ourselves out logistics wise, and then Helen will do the honours because she's great like that. So have a good rest of the day, everybody. Thank you so much for coming along, and take care of yourselves. And do some of that self-compassion and eat some lunch. Yes, if you haven't already, of course. Thank you.